Good afternoon, everyone, and welcome to the regular meeting of the Council of the Township of North Dundas, today being March 18th, 2026. I'm going to call the meeting to order. The meeting is called to order at 1:30 p.m. We're going to move to adoption of the agenda. Moved by Councillor Urick, second by Deputy Mayor Bergeron. Be it resolved that the agenda be adopted as presented. All those in favor? Opposed? Seeing none, that's carried. Any disclosures of pecuniary interest and nature thereof? Seeing none, we're going to jump right into our delegations, and today we have with us Charlie Boland, the President and CEO of the Winchester District Memorial Hospital. Welcome, Charlie.
Thank you. Pleasure to be here.
Oh, please, I need to remind everyone that comes up, closer to the mic or the mic closer to you, one or the other.
Okay.
Thank you.
And I'll just kind of give you the signal for the next slide. Thank you. Well, it's a pleasure to be here this afternoon, and I'm here to talk about the hospital, but I just want to take a minute to talk about Dundas Manor and kind of follow on the last presentation you heard. I've got no update on Dundas Manor, but I do want to acknowledge that we wouldn't be here today where we are with Dundas Manor without you. This council, your preceding councils, the staff, preceding staff, has been instrumental in providing financial support, political support, approvals, support to get approvals, and really, really appreciate it. So I just want to say thank you. You're a big part of where we are with Dundas Manor, and literally we wouldn't be there without you. So thanks.
Well, thank you for those kind words.
I'm here to talk about the hospital. We are in the process at the hospital of a strategic planning process. We're not finished yet, but as part of that process, we talk to our stakeholders, our partners, and that type of thing, and many of them, you folks included, just expressed a desire for more information, and it reminded me that pre-pandemic, we actually came around to most municipalities and gave a bit of an update on a periodic basis, and that fell by the wayside during the pandemic. So here I am today just to give you an update, and also happy to answer any questions at all about the hospital. So go to the next one. So to start off talking about WDMH, which is your hospital, our hospital, every hospital, most organizations have what's called our mission, vision, and values. And we kind of sort of do, but we call ours a commitment. And it's our commitment to our patients, our community, to our hospital, to each other. And you can read it there. I won't read it for you, but many of you will be familiar with Dr. David Flowers, who practiced here for 45 years. Dr. Flowers was actually part of the group that developed this commitment statement, and he came up with the two words he thought that represented the very best of WDMH, and that's compassionate excellence. Excellence, which means we're always trying to get better, but we do it with compassion, we do it with recognizing people are individual, unique, and we do it with the same values that started way back when with WDMH, when it was very much just a small town hospital. So hopefully if you have the occasion to be at the hospital, you see this reflected throughout the hospital and the people and the things we do. Next. So we do things pretty well in the eyes of the people we serve. Every hospital in Ontario has an arm's length organization that monitors or that surveys its patients, and there's the results of ours. We're very proud of that. We have about 80,000 patient interactions a year. That's either admissions to inpatient units or outpatient or emergency. About 1/6 of that, but 17%, comes from North Dundas, which is the largest proportion from anywhere. We serve many other communities. We're proud of a lot of things we do. We just, about 4 months ago in November, had accreditation, which is a national body. They bring in external reviewers, and they assess us against national standards that have primarily to do with the quality of patient care we provide and the safety that we provide our patients. And just as we've done the 3 times previously, they come through every 4 years. We got their highest ranking, the exemplary standing, so we're very proud of that. And it just reflects a consistency of excellence over the last many, many years anyone can expect from WDMH. We have things we're very proud of from a quality perspective, because that's what patients are interested in, whether it's making sure our hands are clean, we don't make many errors for medications. We have never had an outbreak. We may be the only hospital in Ontario back in the pandemic, never had a COVID outbreak. In fact, it's been probably 12 years since we had any type of infectious outbreak in the hospital, and that's due to the vigilance and the professionalism of the people who work there. We provide cancer services. We're a satellite of the Ottawa Regional Cancer Program. There are hospitals our size throughout Ontario that are satellites. We are actually the largest satellite in Ontario, which means if unfortunately someone is diagnosed with cancer and they come to us, they will get the same standard of care they would anywhere else, whether in Ottawa or in other smaller community. And we also have a lot of other inspections, accreditations. For example, our pharmacy and our laboratory get accredited every year, and we do well with that also. Next one, please. So you're probably familiar with most of our major programs. We have 3 surgical theaters and a whole range of surgical programs. Our family birthing unit, labor and delivery, obstetrics, maternity, they used to rank them, and at one time we were the #1 in all of Ontario, and they don't rank them anymore, but I'm sure we're very close to #1. You can see I mentioned cancer care, regional program for people whose kidneys are failing so they can come in for dialysis. We've got our inpatient and outpatient services, and of course our emergency department. Go ahead, next one. And then some new services. If Dr. Paul was here, he'd remind us that in our general area, SDNG, we have a very higher than average rate of smokers. And as a result, we have a higher than average rate of lung disease. So over the last few years, we've put in a pulmonary function testing program. That's something you used to have to go into Ottawa for. It tests the strength of your lungs and your heart. We've had actually hired respiratory therapists who are on site throughout the year or throughout the week. And then we are formally part of the Ontario Lung Screening Program, which means if a physician suspects someone may be at risk of lung cancer, they will refer them to us. We have a special investigative program for that. Next. And then new specialists, new physicians who've come in. Dermatology specialist for the skin has been a bit of we haven't had one for the last 6 or 7 years. Neurology, nephrology, and then ophthalmology is something that's new but not really new. Ophthalmology has in the past been kind of a marquee program. The Lions Club in particular fundraises for ophthalmology and helped us get a lot of new equipment. We used to have 3 ophthalmologists, and 2 retired and one went elsewhere. And then for a couple of years, we tried to recruit an ophthalmologist and we just couldn't. And then lo and behold, at the end of last year, we struck gold and found a new ophthalmologist who's actually started clinics and started operating in January. So that program's been reinstated, and we actually have another couple who've expressed interest in coming and joining us. So there's a positive there. Next. Aside from the great care we provide, we also do teaching and research. 2012, we started a family medicine residency program. And what that is you may be familiar with this, when a physician finishes his or her 4 years of medical school, they have to do a residency, which is at least 2 years. It's kind of on-the-job training under supervision before they can be an independent physician. And they used to only be held at big hospitals, the Ottawa Hospital, CHEO, MOFOR, and they'd come to Winchester for a week and to get exposed to the rural setting. They actually called it a week in the country. So a week is no time at all to get experience in anything. So back in 2012, we started a family residency program on site. So at that time, 2 residents would come and spend their entire 2 years of training at WDMH, which is a reflection of the breadth of services we could offer and the quality of the teaching by our physicians. And this year, actually 2026, we'll have 10 of those residents. So there's kind of tangible and intangible benefits of that. The intangible is you've got new blood coming into the organization and with new ideas and energy and that kind of thing, and that really feeds our drive to excellence. The other really tangible part is we hire as many of them as we can that want to stay, and very often they do want to stay. So whether it's working at the hospital or working in a physician's offices somewhere around here, so many of them do stay. And that's just physicians. We actually have several hundred other students who come with us, nursing students, physiotherapy students, pharmacy students, health admin students, and for all the same reasons. We either hire them and they bring new ideas and energy into the building. And then we also do research. And if your idea of research is seeing someone kind of in a lab coat and a pocket protector with a clipboard, it's not really that. We want to do research that actually contributes to us as a community and our patients. So we've done some early studies that talk about, you know, what it's like to be discharged from a small hospital versus, say, one in a city, how to best access mental health for kids in ER and that kind of thing. And lately, we've been moving towards clinical trials of new drugs. And these are things in areas like respiratory system, circulatory system, obesity, that type of thing, some stomach upset conditions. And when a company brings a new drug tries to bring it to market, there's 3 phases. The first phase is, does it cause any harm? The second phase is, does it do what it's supposed to do? And the third phase is, does it really do what it's supposed to do, and what should be the proper dosage? So we're in the third phase. We're always in the third phase. So when I talk about experimental drugs, they're not so experimental anymore. The real benefit is to our patients who, with some of these conditions, wouldn't normally have access to these drugs until 2 years down the road. So it's a real benefit for us to be learning as an organization, and it's a benefit to our patients too. I say we lead a health hub. I don't know what exactly to call it. Actually, the last government called this type of thing a health hub, so we continue to use it. And you're probably familiar with this. If you come onto the, call it the hospital campus, we have the hospital, we have Dundas Manor, we have the Dillabaugh Center and community care building, and really almost every health and social service in this area is on that campus and in one of those buildings. And it's a great partnership type of thing. Ostensibly, we are the landlord, but we're also, you know, we try and share education, we share anything at all. You know, it's nice if someone comes to the hospital and the physician decides they need a vaccination, they can be referred across the parking lot to the public health unit. We also have we have one of the largest computer centers of any hospital outside of Ottawa, and we are the regional hub for for example, all the laboratory data from any hospital in Eastern Ontario resides at WDMH. There's 2 big applications that physicians use, e-referral and e-consult. And there are other things that reside to us. So what's the point of that? It's all big bits and bytes behind closed doors. Well, we get additional funding for those things, and we can use part of that funding for our own computer purposes. And as I'm sure it exists anywhere, not only do we have computers for, you know, payroll and bookkeeping, that kind of thing, most of our clinical services are computerized. And if you go to OR, anything that's electric is plugged into a computer somewhere. So it's really important that we have as much computer support to keep everything running properly at the hospital. One of the trickiest questions I ever get is how many people work at the hospital? So we have a little over 400 on staff. We have almost 250 doctors, dentists, and midwives. That's really almost all doctors. We have 1 dentist and I think 8 midwives. We have a few, 75 or 77 volunteers. We had actually a couple hundred before the pandemic, and unfortunately many just didn't return. So if anyone knows of anyone who would like to volunteer at the hospital, an hour a week, a couple hours a month, we'd love to hear from them and we'd welcome them on board. And then there's the students, the trainees we have. So if you ask how many people work at the hospital, it's somewhere between 400 and 900. And unlike many other organizations and hospitals and the like, we are fully staffed. We are a place that people want to come to work. That's not by accident. We really worked at having an attractive, positive workplace. And you know, we have the natural turnover that a staff of 400 would normally have, but if we put out an ad, we get lots of applications. So we're very fortunate with that. Next, please. We're very accountable. We had a balanced budget for 15 years until 4 years ago. And then we've had a lot of financial challenges the last 3 or 4 years. Fortunately, just before Christmas, the government provided us with an injection of cash to provide some stability. So it's going to see us through this year, and depending what happens in the provincial budget, it'll probably give us, we're hoping it will give us stability for several years. We have among the 64 small hospitals in Ontario of the 145 total hospitals. We have the smallest administration of any hospital, of any of the small hospitals. That's not great for getting things done, but it does reflect the fact that if you pay $1 or WDMH gets $1, it goes farther for clinical and patient care than it does in many other hospitals. We're always meeting or exceeding government efficiency targets, and I mentioned we've got great staffing. Among any hospital we compare to, we've got the lowest overtime, lowest sick time, and we've never had to use a staffing agency because so many people come to and want to work with us. Next. So our challenges, I mentioned our finances. It just remains to be seen how the government gives us some longer-term stability. We've had a real turnover in staff, and we do staff profiles, and from 10 years ago, you'd see that the majority of our staff had been there quite a while, and most recently, our profile shows the majority of our staff have been there 3 years or less. That's great for seeing us through to the future. It does provide some challenges when you have such a large amount of staff with limited experience, but we're working on that. For any hospital, especially smaller hospitals, buying machinery, buying technology, artificial intelligence, that kind of thing, it's quite expensive, so that remains an ongoing challenge. Cybersecurity is a threat for every organization in the world, and we're no different than that. We've had some very serious attempts, but we've never had very successful cyber attacks. When you talk to anybody about WDMH, most of the time it's pretty complimentary. If there's at least one criticism, and there's more than one criticism, the most common one is our ER wait times. We're no better or worse than most other ERs. We continually work on it. We and every other hospital has additional government funding to try and develop or streamline our processes and add things where needed in our ER to reduce wait times. But as you may know, when you come to any ER, it's not first come, first served. If you come in with heart pains, you'll be seen right away. Depending on the day, if it's something of lesser acuity, you may likely wait quite a while. And our next big project will be to get an MRI, which is a diagnostic imaging machine. It's really the only significant common test that you'd have to leave Winchester for if you needed it. And 2 years ago now, we submitted our application to the government for an MRI, and it's, from what we understand, it's just up to political will on whether it's going to be approved and when it's going to be approved. So in any of your travels and you come to touch with a conservative or Premier Doug, feel free to put in a plug for our MRI. So that's a very much in a nutshell about WDMH, and be happy to answer any questions.
Well, thank you, Mr. Bolden, for that presentation. And before I pass it over to others, I just wanted to make a comment about the appreciation that you recognize that you haven't been here in a while, and it's something that we've talked offline about different times, and I do mention to others that how important it is that we, not just the council, but the public that are in attendance, the public that are online, the media, have an opportunity to hear directly from you, or as most recently Ms. Poirier talking about Dundas Manor, how important that is to all of us to have a better understanding of the successes and the challenges, and you mentioned the challenge at the very end, that your organization faces, so that whenever we do bump into our provincial politicians, at least we have something to talk about, more than just the weather. But anyway, saying that, I'm going to turn it over to questions, comments from members of council. So I do have things that I've been thinking about. I've had an opportunity to speak to you, or to hear you speak about what goes on at the hospital, and you did touch on it more than just briefly, but the teaching and training programs, and I like to brag about it. It's not mine to brag about, so maybe you could expand on the teaching training programs and how, I don't want to say how we should be seeing as fortunate, but how fortunate we are in a rural community to have the proximity to the city of Ottawa and the Ottawa Hospital and some of the programs and opportunities that come because of that. So if you could,
Sure.
if you don't mind weighing in on that for a little bit.
So literally every hospital has a smattering of medical students and nursing students typically who come through, and they're typically local people who want to get trained and stay at home during the summer, that kind of thing, and get trained. Ours is not that. Ours is a very formal teaching program. We're predominantly affiliated with the University of Ottawa and St. Lawrence College, but we actually have students in agreements with just about every university and college you can name. And if someone's neighbor is a medical student in Zurich or Australia, I'm speaking from experience, and they want to spend some time in WDMH, we work something out with them. So in terms of our medical residency, that's a very, very formal program that's supervised by the university, and if you need to complete a lot of things for them to bless you and be a formal physician at the end of those 2 years. There's registration and exams and that kind of thing. So that's equally important. The most other common student in our hospital are nursing students, and there's a time that the supply of nurses and demand for nurses goes up and down and up and down. We're very fortunate because of the relationships we have with St. Lawrence College and others that we have had a steady supply of nurses who come in for training, and at the very end of their training they do an extended placement, and by virtue of that many have already decided if there's opportunities that they want to be in WDMH, that there's potentially a job for them. And then on a smaller proportion, smaller scale, are literally every other position in the hospital. We've had training opportunities for students who come through whatever educational institution. And as I mentioned, really honestly, it's great to have them for the energy and the ideas they bring, but it's very much distinguishes us from many other hospitals, many other smaller hospitals, definitely. And it does give us an additional avenue to hire people in times when there's fewer supplies or lower supply of physicians or nurses or anything else. We've got people who are on board, and we've kind of done an ongoing audition with each other and decide whether we want to continue that. So it's made us very fortunate. But just the fact that we have a family residency program, a research program, a hospital our size, distinguishes us and would allow you to brag about us anywhere you went.
Well, I just need more information so I can continue bragging. Thank you. And then something that we stood in line about, I think, last year, and that's coming, hopefully we'll be doing it again this year, the PSA testing. Yeah. And well, we have 3 people in the audience today that it pertains to. And so if you could just talk about the uptake on the PSA testing, the per capita uptake, and how well it's managed here in North Dundas.
Okay. Well, I can take very little credit for that because, as you probably know, we have a very active, energetic group of gentlemen who are prostate cancer survivors in this community. And it is they that led the push to have this happen. We've been doing it since 2015, which on typically the Saturday of Dairy Fest, we have about 4 hours of the day where gentlemen are invited to come, and ultimately they get a PSA test, but it's really there for some congeniality, for some to get opportunity for education about the need for screening or prostate health or prostate cancer. We have a urologist who's on site who oversees this from a medical perspective, and all the hospital staff that take blood, that do registrations, are all volunteers. They all decide to volunteer their time on that Saturday. And I can't remember, I know the data is set down somewhere. In the early years we'd have 50 or 100, now we have more than 300 who show up. And typically a percentage, I really can't remember the numbers, 20 or 50 would have some type of test that doesn't necessarily mean they have cancer, but requires follow-up with a physician, in which case they normally, they wouldn't have that information, that they wouldn't normally have gone on their own to get a test and get that information. So it's been wildly successful. Again, it's largely pushed by our local prostate cancer survivor group, but other groups that have been involved in it now are prostate, I think there's an Eastern Ontario chapter for prostate cancer survivors and that kind of thing, and then the Ride for Dad, who provides some funding for that. So it's a very successful thing and seems to build every year.
It is, and that lineup is like a lineup for swag or free beer.
Exactly.
It's quite a lineup of men.
Refreshments to keep
refreshments, maybe, yeah. No, it is it's so important to see that uptake and that opportunity for the PSA testing to continue. but to see the amount of fellas that show up and willingly show up and are there. So that's a good opportunity for all of us in the catchment area and beyond. I'm sorry, I guess it's easier. The health hub. You talk about the health hub, and that's something I brag about is the health hub, and there's been efforts made from staff to expand on that health hub concept of more social services being offered. You mentioned the community care center as part of that health hub, and I know, and you know that there's efforts being made to expand that social aspect of it, so that more services can be drawn out to this area, and because that is, and I think of the drone video I had taken a few years back over top of Dundas Manor and the hospital and the police station, fire hall, the school. That is a great opportunity to have a centralized spot where people know how to get to, and all the services that are needed, or most of the services that would be needed, are offered here. So we'll continue working on that health hub issue, or expanding the health hub. To the political will, I think maybe more information is needed from you. So whenever we do go to Toronto, there are a few of us going to Toronto shortly, and to meet with our provincial ministers, and there's always time for chatting. So, and arm twisting.
Yeah, I'm happy to follow up with you. I'll just tell you very briefly, the wait time in Ontario to get an MRI continues to increase, so it's not going down. It's in very high demand. And in short, we've done absolutely everything. All our information is in the hands of the Ministry of Health. I understand we're one of several hospitals that are just kind of waiting, and we don't know the length of that wait is going to be, or whether it's successful or not. But,
well, I'm guessing the
more
connection to the connection with the training and teaching and the MRI. I think that's something that we could use as an argument point. I'm sorry, did I cause anyone thoughts, questions? Nope. Thank you.
Yeah, just a comment. The mayor pretty much hit everything on the head here. As we spoke earlier, like I'm a huge fan of your organization. I think you're doing great, community within a community, with excellent or compassionate excellence. I like it. I like it all. I like hearing about this, and I wish the last 3 years while I was on council, I got to see you more. But it's a good final year, and yeah, by all means, we'll twist arms and we'll put up free beer signs up in Toronto and hopefully get some ministers there.
Good strategy. We hadn't thought of that. Yeah. I just want to say, if anyone ever has a question, a compliment, a complaint, or just heard a rumor about the hospital, you want to find out about it, feel free. Give me a call, send me an email. Happy to talk to you.
And I can vouch for that. I do give you a call once in a while, and I'm always surprised that you answer. You don't have call display. So anyway, thank you very much, Mr. Boland, Charlie, for the presentation. I look forward to this taking place.
Sure.
Not frequently, but more often.
Okay. My pleasure. Thanks again.
Thank you. So we're going to move into staff reports. I'm going to call on Director Pohl. Key information about the Beachcroft Seniors Apartment Parking Expansion Request. Councilor Hannibal.
I'm going to back away from this discussion. I chair that board, so I just feel it's right that I take a step back and listen to what everybody's got to say. Thank you.
Thank you. Director Pohl.
Thank you, Mayor Fraser, and good afternoon. So we have a request from the Winchester Nonprofit Residents Corporation. It's part of the Beachcroft Seniors Apartments. They currently have 45 affordable housing units on their site, but only 32 parking spots. And as you know today, most people have at least one vehicle, so in this case, there's many spaces not available for people who are residents of the Beachcroft, as well as visitor parking availability. So their request that they've put forward is to look at some additional parking, which is shown on oops, go back a slide. The township property, we own a piece of land adjacent to the Beachcroft and adjacent to their parking area, and they're looking and requesting if council would consider offering some of that space for parking. If you can roll the next picture. So just to give an idea of the existing parking standards, when this was built in 1985-86, the bylaw only required 12 parking spots for this type of facility back in the early 80s. Today's zoning bylaw, based on what it is, only requires 15. It assumes, I would look at it and say, it assumes nobody has a vehicle, or that's pretty much your visitor parking when you only have 15 spaces. Typical apartments in the village, in the city, in this municipality would require 57 parking spots for that size facility. That would include for residents and visitor parking. And the Beachcroft only has 37 spots. And the other, that is an image of where the parking could be expanded to on the left, and the existing parking lot on the right there. So on the next page, I put a little sketch together or from the survey to show where the township property is. It's assumed that this property was taken over by the municipality as parkland. When this subdivision was developed under the Planning Act, you're entitled to 5% of the land for parkland purposes. And that's assuming that if you looked at the size of this, that would be close to 5% of the land for parks and a Beachcroft around it. So one of the proposals, I just sat with a little pen and paper and sketched out quickly a design that could include additional parking. Using one of the pieces of that block, about a third of the property, and this would add about 15 spaces without an exit, because there is a municipal ditch along the roadside there, so providing another entrance would have to have a culvert and additional expenses and everything associated with it, and security issues. You generally want one in and out of a building property. So in this particular case, we'd also go around, there's a tree in front of the red car there, about halfway through the north side of this lot. There's an existing tree there. This would work around it. So you'd lose a few spots for the tree, but you save a tree. And this way, there is 2 other trees that would likely have to be removed for a parking lot of that size. So this is an option for council. It could be reduced even from there to lesser spaces, depending on what the actual need is of the Beachcroft. In the letter, we did not get any information as far as what's the actual need. Is it 10 spots? Is it 5 spots? Is it 15? So that could be hammered out if council wants to pursue this further as part of the request. And finally, in the last slide, there's just an image of the actual zoomed in part of that piece of land that's owned by the township. It is 3 separate lots or parts of a lot. So it's easily surveyed for purposes of, so if you're going to give it to them or donate it or lease it to the individuals, we could actually legally describe it without having to get a survey of this property, because it is a part on a plan right now. Even though it shows part 5, it shows lot 8. Lot 8 could contain all of those 15 parking spots that were sketched out. So we just scroll up a little bit. So the question for council or considerations, there's 3 options. Would council consider conveying the land, the 50 by 106 feet from the township to the Beachcroft? A second option would be, rather than conveying it, is to lease the land. You could do a long-term lease with them where they would be responsible for maintaining it, building it. The option there, if council ever in the future decides that there's something else you want to do with that land, or if the Beachcroft wants to expand onto that land, there's other options available. That still keeps it under the municipal control. Or the third option would be, if council prefers that this area remain passive space, no further action be taken. And one note I had in the report too is that the grass is, this area of the municipal land is actually maintained by the Beachcroft, not by the municipality. So they are already cutting the grass, so that could be part of an agreement that they continue to do that, if council so wishes.
Thank you very much, Council. Not Councilor. This we're not in Russell Township. The former councillor from Russell Township. Thank you, Director Paul, for that information, and I see Councillor Lennox has a comment.
Yeah, just comment. I'm open to number 2, long-term lease. I think that's the best use case for the younger ones in the crowd. I'm looking to my right. Reason why there was probably only allocation for 12 parking spots back in whatever year former councillor Director Pohl referred to in the 90s was because horses. Look at all that beautiful green land. I'm just kidding. I think they had cars in the 80s. anyways, yeah, option 2, definitely, it's better for the township long run here in case if the intent and usage were to change.
Thank you, Councillor. Further comments? Deputy Mayor.
Well, it's one of the first two choices. If we sell it, that leaves an awfully small piece just all by itself in the corner, which I don't know what use that would have. And so probably a lease, because the construction could change over the years, we don't know. And we'll still own it. So I'm okay with option 2.
Thank you, Deputy Mayor. Councillor Urick.
Yeah, I'm in favor of options as well. It gives them what they need and gives us that kind of different force in terms of what the space may accommodate one day, and also doesn't kind of tie up the entire area in the event Beachcroft does expand.
I'm not going to, I don't need to weigh in. I think the direction's been offered. I just wanted to make a comment. I arrived at the Beachcroft not many times, but enough times as a member of the fire department with the truck for emergencies. It's a tight spot. It needs expansion, and if there was an emergency or a rush, I look forward to this taking place because it's needed. Long and the short of it, it is very, very tight in there, and yes. So direction's been offered, and I appreciate if I'm sure we will be made aware of the arrangements that are being proposed for number 2. Okay, thank you very much. Then we'll move on to the next item. It's 10 King Street, the CIP Facade Grant, and Director Paul, you're going to speak to that. It's moved by Deputy Mayor Bergeron, seconded by Councillor Annabelle. Be it resolved that Council approve a facade improvement grant of $1,816.16 for Daphne Elizabeth Evans and Ricky Denzel Froats under the Township of North Dundas' Community Improvement Plan for the building located at 10 King Street, Chesterville, and that Council authorize the Mayor and Director of Development Services to execute the required agreement. Director Paul.
So this is a request for a grant to expand the front facade area, to introduce a new deck out front to allow for more commercial space in the summer for vending and selling things out of the building. They can also sell outside, so this is an improvement to the property to allow them to expand and offer a different level of service at the front of this commercial property.
Thank you. Questions, comments? Seeing none, all those in favor? Opposed? Seeing none, that's carried. Thank you, Director. We're going to move into transportation. Director Cheney, bylaw number 2026-26, new assessment schedule for municipal and engineer for maintenance and engineer appointment, sub 76 Moffat Creek Municipal Drain, moved by Councillor Annabelle, second by Councillor Lennox. Be resolved that Council accept the request for a new assessment schedule for maintenance under RSO 1990 CD 17 S76 1 2006 C19 Schedule A sub 6-1 of the Drainage Act for the Moffat Creek Municipal Drain in the former Township of Winchester, now the Township of North Dundas, and that bylaw number 2026-26 being a bylaw to appoint Monica Shade of Shade Group, Inc. as a drainage engineer to prepare a new assessment schedule for maintenance on the Moffat Creek Municipal Drain in the former Township of Winchester, now the Township of North Dundas, be passed and enacted this 18th day of March 2026. Director Cheney.
Thank you, Mayor Fraser. Members of council. So maintenance has been, requested on the Moffat Creek Municipal Drain. It was originally constructed in 1896 through the Township of Russell and the former Township of Winchester, now of North Dundas, with known improvements completed in 1948, 1978, and 1980. The current assessment schedule, adopted in 1978, is outdated to land severances and land use changes, and a new assessment schedule is required. This new assessment schedule will only apply to our section and will not the portion of the Township of Russell.
Thank you. Questions, comments? Seeing none, all those in favor? Opposed? Seeing none, that's carried. Move on to Environmental Services. Director Ward, North Dundas Drinking Water System Annual Report. Moved by Councillor Lennox, second by Councillor Urick. Be it resolved that council receive and accept the North Dundas Drinking Water System Report for the period of January 1st, 2025 to December 31st, 2025. Director Ward.
Thank you, Mayor. And good afternoon, Council. So in front of you this afternoon is the annual report for the drinking water system. Council will note that there's also a wastewater report that will follow. It's just this one has to be submitted before March 31st, so it's prepared first. Overall, in 2025, there was no incidences of adverse water quality or any issues of non-compliance within the water system. I did prepare some information for council about where we're at with regards to our permit to take water and how much water we're actually taking. So if you'll note, of the rated capacity of 102.75 liters per second, in 2025, we only took 56.8 liters per second. So that's just a little over half, and council's well aware that that was due to the drought that we faced in 2025. We did see a decrease overall in the system use of about 47,000 cubic meters. So again, directly related to the drought. So we had asked everyone to consume less, and they responded and did that for us. With regards to water quality, so we do get a lot of questions about that. And just to highlight for council, the only item that is over the limit is sodium. However, it's still underneath the federal limit of 200 milligrams per liter. We're currently at 144 at one of our wells, and I did list in the report why that would be. And if you have any further questions, I can answer them at this time.
Thank you for that report. Excuse me. Councillor Lennox.
Just a quick question regarding sodium, since you brought it up. Although the federal level is 200, above 20 you have to notify the health official, correct? Now, when you get up into the hundreds of mgs, what kind of effects could that have on people? Anything, or is there a group of people who shouldn't be drinking or consuming water that has 144 milligrams of sodium in it?
So through you, Mayor, to Councillor Lennox. So there are, this is reported to the Eastern Ontario Health Unit, and that information is then distributed to doctors who see patients within our area. And those individuals who are on a restricted sodium intake diet, they would be notified that they should not drink the water, or if they do drink the water, it should be in a limited capacity, or find an alternative dietary measure to not consume as much water. So, so those are kind of the aspects, but we do work with the health unit on that.
All right, that's perfect. You actually answered my follow-up question of how does the communication get out there, and it's through their doctors. Perfect. Thank you.
Thank you for your question. Further, I just want to piggyback on your thought and your comment about appreciating the efforts made by the water users in North Dundas to pay attention to the message delivered that we need to conserve. And thank you very much for to those people, to all of the residents that paid attention. It was well appreciated because it was a dire time. Saying that, no further questions, comments. All those in favor? Opposed? Seeing none, that's carried. And then we can move into the water allocation request 078, Lactalis Canada Inc., moved by Councillor Urick, second by Deputy Mayor Bergeron. Be it resolved that Council approves water allocation request 078 for 75 units of water and sewer, being 157.5 additional cubic meters per day, and that the Director of Environmental Services be authorized to enter into a water and sewer services agreement with Lactalis Canada Inc. to reflect the increased flows for water and sewer. Director Ward.
Thank you, Mayor. So this report is being brought back to Council. I believe Council will recall last year Lactalis came and gave a delegation to Council to explain how much water usage they would require as part of their planning process for their capital investments. We further refined that request with Lactalis, and they have now requested 75 units rather than 175 units. And some of the reasons for that are outlined in the report, but primarily due to conservation efforts on their behalf. So we thank them for looking into that for us, as we all know water's limited. So with this allocation request of 75 units, I just run through with Council how much that would mean for Lactalis. So for water, if Council were to approve the 75 units, they would then have 804 units in total, which is about 1,688 cubic meters per day that they would be allowed to use. And then there's sewer, because they don't have the exact same amount of sewer as they do water, because there was an agreement made previous to this council. They would have 184.8 cubic meters that they would be allowed to use. Both of these flows would be monitored through the township through flow meters that we would have installed, as council is already aware. So that work will happen in April before this allocation takes effect, so that we have a way of monitoring. With regards to future use, so if they go over that amount that they've requested, there is that excess use rate that council is aware of that was in the report, and as well the capital charge should they exceed that over 90 days. So there are some financial ramifications if that consistently goes over the amount given. If there's any further questions, I can answer them at this time.
Well, thank you for that and all the work that went into getting to this point. Questions, comments? Deputy Mayor.
Thank you, Mr. Mayor. I'm sure you knew I would have some comments today. And Matthew, you can just relax over there. Thank you. Listen, I'm really glad that they finally implemented some conservation. And for the public, just so they understand how much money is being, how much water is being saved, just the conservation methods that they used, it comes to 221 cubic meters per day. That is 221,000 liters per day. Every cubic meter is 1,000 liters. I don't know if the public is aware of, those amounts. By 2028, if they put that recycling system in place, they're going to save another 350 cubic meters. So after 2028, they will recover 500,000 liters of water per day. So, I'm really pleased to hear that. But at the same time, I'm between a rock and a hard plate, because financially, we need to pay off for the expenses of the water, for the infrastructure of water, for the debt that we have. And I was just talking to Danielle before the meeting, because I know a few months back we got a report from someone saying that, and I thought in my head it was we had to have 60 new hookups per year to be able to cover all these expenses. And this year, in 2026, we probably won't have that. Although we have the water, the contractors will be starting on their housing, but by the time they build the roads and connect infrastructure, probably housing won't be completed until 2027, 28. And from Mr. Pohl's graph that's in purple or up, within the next 2 years, we see 400 and something units coming up in 2020, 27, 28. If this does occur, what's going to happen is that we're going to run out of water from the numbers that are on this chart within 5 and 10 years. Again, so we're going to be in the same place as we are now. The other thing, too, is yes, we give them the 75 units. That will help pay off the money that we owe. At the same time, we're going to lose that property tax revenue, because every time you give them water, their property taxes don't go up. And
Excuse me.
sorry.
I think saying that we're giving them the water is the wrong impression.
No, well, I mean
And
allocating. No, they're
that's-
paying for it. No, they're paying for
Well,
it.
but
They're-
you're saying give them.
They're paying for it. But the other side of that is we're losing those 75 units to build houses, which would bring in taxation revenue, property taxation revenue. And it's not a small amount. It would come to about $150,000 to $200,000 a year. And in the big picture for water capacity, well number 8 is in the same aquifer as well number 7, which is in the Morewood Aquifer. The Morewood Aquifer is part of the Vars-Winchester Aquifer, which is 55 kilometers long, so you would think that's a lot of water. But the research that was done in 2023, the catchment area for the Morewood Esker is just close. It's very close. It's a small area around Morewood and to the northeast. And that whole aquifer, it isn't one big lake, where if it rains in Vars or Russell, it all goes into the same big lake, or a river going one. Underground, there's all these little currents. And so any precipitation, for instance, north of Russell, we don't feel that in our aquifer. we only feel it around the bog, northeast, and then also the one at Maple Ridge, that's its own little catchment area also. So the Ministry of Environment tells us that we need 30% forest cover for a balanced water cycle. And MNR in 2025 has us at 12.5% forest cover. So that's going to negatively impact how much water we get in the cycle for the aquifer. At the same time, Richards, in their 2023 report, they actually had a section on climate change. And in that section, they have where the Ministry of Environment forecasts that by 2030, when it's only 4 years away, we will see, with climate change, more precipitation in the winter and hardly any in the summertime. Like from July to September, we will have dry summers. That is what they predict. And even if Russell gets a thunderstorm and they get 4 inches of rain, we're not going to feel it in our aquifer. And so for me, the bottom line is still, if we want to have a supply of water that we can depend on, we need to go to Morrisburg. And that still has to be in the long-term plan. And the long-term plan is, I think, less than 10 years from now. So that's my thing about the 75. As for the overuse allocation, I agree that 10 times the amount is good. But to only come to us to make it an allocation above five units and more, I would prefer to see every occasion from 1 unit, because the water is so scarce for us and it's so important. So if we have one user who wants more water, but it's not affecting our tax base, we need to decide whether we want to allocate that unit to that entity or to put it somewhere else. And now I leave it to my colleagues to make their comments.
Thank you, Deputy Mayor. Further questions, comments? Councillor Lennox.
Just for the Madam CAO or Director Ward, was Lactalis in Toronto for Roma or made any attempt to write the ministers?
Through you, Mr. Mayor, Lactalis joined us at Roma for a different delegation. However, administration has been in touch with them, and they are doing their bit to advance some of these priorities forward with the ministries.
Okay, perfect. And I will give the mayor and rest of council the benefit here of knowing my intentions with this one. My vote will be to abstain. And if you think about it, I'm really voting for none of the above.
Well, thank you. Any further questions, comments? I think this has been a great effort to get to the point where we're at that's been presented to us. As it was reported, there's dire straits, and the challenge was put out there that conservation's efforts were absolutely necessary if conservation efforts were absolutely necessary if conversation was going to continue. I think I got that right. And so I think some of the efforts, or the efforts that have been demonstrated, which I'm sure there's a cost, they've answered that call to make some efforts. So I appreciate the efforts made. I appreciate the efforts made in-house to get to that point and to support those conversations. And the Deputy Mayor did touch upon it. The water's there. The bill to pay for getting the water there is outstanding and needs to be paid. That money needs to be recovered. And some of the conversations that we were party to about growth, and I think of some of the stories, some of the reports or comments made by developers. A developer was, we could do this, but the current housing market and the current expense and the current inflationary pressures really is restricting the number that we will probably be able to build. So there is hesitation there. And but there is a willing partner to pay for the water that our ratepayers are paying for currently, and we need to make sure that we recover some of that water, some of that investment we need to have money come back and support the efforts made or the expense incurred to get that water here. And to the Deputy Mayor's thoughts about water from, she mentions Morrisburg, that's been a conversation we've been having and a conversation that's going on. It's a conversation that I know our local MPP and I have talked about different times about that is the end goal, to get to that point of having more water, more than likely from South Dundas. But who knows what that holds. We do have a big neighbor to the north, and we're not sure exactly where we're at with them. Conversations have been started there too. So we are making efforts to ensure that the stopgap interim measures that are getting us over the challenge of not having water, we're well aware that, and we want to make sure everyone's aware that that is not the end of the efforts. The efforts continue. We do understand that we need to make sure that that's there, but we also need to understand what the housing market is going to hold, because if we were to go down a path of bringing surface water in, we have to pay that bill too. And that bill would be quite a bit larger than what we're suffering right now. We have to make sure that there's employment, that there's opportunity, that there's a reason why people would want to move to North Dundas. We have to be very, very concerned that we have the right information and the opportunity there, that people see that this is a place to live, raise a family, and to do business. So, saying all that, I think there's been great effort made in this. I think there's great challenge has been overcome, and I think we need to make sure we go ahead. Councillor Urick.
No, and on top of that, Mr. Mayor, I'm content with what we're presented here today. They came before council. We collectively raked them over the coals. We told them to do better, put more conservation efforts in. They've come back and done that. Yeah. They've reduced what they're asking for. I think maybe for the first time in several years of this plan operating here, they're not taking a holier-than-thou stance. And, you know, we're here and we'll leave if you don't do this for us. I think they recognize the situation we all find ourselves in. I'm content with it as is, and knowing that kind of what measures continue behind the scenes, both at the plant and internally to the township, and, you know, different discussions that are ongoing. I'm happy with what we have here today and move forward with it.
Thank you. Before I get to the Deputy Mayor, I'll give maybe Councillor Annabelle a chance.
Seem to be making a gallant effort, and I'm sure over the next few years it'll change in improvement again. So I'm quite happy.
Thank you. Deputy Mayor, do you have more to say?
Yes, Mr. Mayor, I just had one question, maybe to the CEO and maybe you. Has there been any talk about how we're losing taxation revenues with all the water they have, and that maybe somehow they should compensate us for that? Because it is a lot of money.
Well, there has been conversation about that, and some of the conversation was, I look at the historic growth over the last number of years before the drought, before it was an issue, when we had 300 plus. I looked to Director Paul, I'm going to say, or Director Ward, this is a long time ago conversation, when we were doing the 20-year plan and how many hundreds of units we had available and how many hundreds of units remained available every year. And what was the growth percent? 1% growth? 3% growth. We're suffering, you know, we're enjoying 3% growth during the time when we had an abundance of water. And we weren't growing at the rate that is somewhat being proposed. We weren't on the radar, and so we had all of this water for years. And it was a 20-year plan, and 20-year plan, I call a 5-year plan. It quickly disappeared whenever people recognize that there's a good opportunity to build in North Dundas. So I think to your question about the tax dollars lost, ratepayers were paying for water that was sitting in the system, and we didn't have taxpayers or new builds coming in at that time. And so I'm not sure if it's a really true argument that we would have had all those tax dollars from the water they were using, because we had an abundance of water when they were using all that water, and they weren't building houses at that time. So I'm not sure if that is a very good argument to propose, because they weren't building and we weren't receiving extra revenue from new builds when we had an abundance of water, and Lactalis or Parmalat was still using water. So it changes. Okay, but as for conversation, we're aware of what the tax dollars could be. Yeah, not denying that. We're aware of what it could be if all of a sudden we were populated and we had the infrastructure to handle that. But currently we don't have the infrastructure to handle all of those builds, as we know. So, saying if there's nothing further, we've all heard the question. All those in favor? Opposed? Seeing none, that's carried. And we're going to continue with Director Ward, and we're going to move to the South Asian Conservation Risk Management Official Funding Request. Moved by Deputy Mayor Bergeron, second by Councillor Annabelle. Be it resolved that Council approve the funding request for $13,800 for 2026 to delegate Part 4 responsibilities to Raisin South Nation Source Protection Authority, and that Council supports staff in exploring internal capacities to undertake this work in 2027. Excuse me, Director Ward.
Thank you, Mayor. So we are coming to council with a request from our Source Protection Agency. So a long time ago, municipalities delegated the authority to create source protection plans, and then therefore also the Part 4 risk that associates with that. So originally this was delegated to our partners at South Nation and Raisin River, and together they conduct risk mitigation, do source protection plans, as well as do a number of other things such as educational components, educating people within a source protection area what they can and can't do, and reviewing planning applications for any new developments that come within those areas. This was all originally covered under the province, so they used to fund that entity to do those things. That's no longer the case. So there has been some changes to Section 36 that actually require some follow-up on some of the existing risk management plans. So with all of the new things coming out of that, South Nation and Region have reached out to us to ask if we would like to join in with some other municipalities to fund a position to take on those tasks. And that would be a very in-depth look at all of the risk management plans that are within source protection areas. So immediately our mind goes to Winchester, and there are some big entities within Winchester that are within a source protection area. But it's also important to keep mind of when we did Wellfield 8, the source protection area has changed in that region from a pancake to more of a linear function. So there are there's a lot of agricultural properties within that source protection area that weren't originally in a source protection area. So there is a lot of work that will be involved in that as well. That being said, by funding a shared position, and the CAO and myself have had quite a few discussions with our Conservation Authority neighbors about how this would work. So essentially, our funding cost is shared for this new position, and this position would be funded through an internal moving of people, if you will, for layman's terms. And this person would just be responsible for source protection planning and risk mitigation in those areas for these municipalities. So that would be their only job. They wouldn't be doing anything else. If council decides not to fund this position, what they will do is they will still continue to do new planning applications. So anytime a new planning application comes in, they will still review it to make sure under Section 36 that it is meeting those requirements, and if a risk management plan needs to be completed, that one is completed. But that would be the extent of where their role would be, and that the municipality would then have to figure out how to visit the existing areas that are in there, and also follow up on those risk mitigation plans to make sure they're actually being employed in those areas. Internally, staff have registered for the source protection training that's offered through the province. It is a free program. So what that allows us to do is operate as the risk management authority in this area. And that's why we're asking council to maybe consider allowing this source protection agency agreement for the 16 municipalities in this particular instance in 2026. And then in 2027, we might have some capacity internally to take that on, and that would therefore not be a cost in 2027. If you have any questions, I can answer them. Sorry.
I'm having a hard time coming up with one. Thank you. If there's nothing else, I look to our deputy mayor. You are on the source water protection?
I know, and now with, the government implementing, consolidating the conservation authorities, we don't really know what's happening. We don't even know what's going to happen to us if we're going to, we don't know anything right now. And so, I agree that for this year, to do it this way, to share with the other communities, and then by the end of the year, you'll know whether we can do it ourselves or not. And by then, maybe we'll know what's happening with us. I don't know. We have a meeting next week. No, I made a mistake. It's actually March 27th.
Okay.
But we have a meeting, and maybe I'll know more then.
Do you think that would be a topic of conversation?
Oh, yes.
Okay.
Yep.
Okay, thank you.
Yep.
I look forward to more information on that. Councillor Urick?
Yeah, my only real thought or question was going to be similar to the deputy mayor's, is how this all shakes out now that consolidation is seemingly going forward and being forced upon the conservation authorities. So really, I guess for this year, continue as is, and we'll see what 2027 brings. Thank you.
Anything further? All those in favor? Opposed? Seeing none, that's carried. Thank you very much, Director Ward. We're going to move into the consent agenda. Moved by Councillor Annabelle, second by Councillor Lennox. Be it resolved that all items listed under the consent agenda be approved/filed as recommended. Questions, comments? All those in favor? Opposed? Seeing none, that's carried. I jump right down to number 7, items for consideration. I don't have anything in front of me. Notices of motions, nothing in front of me. County Council. The Deputy Mayor has some notes.
We just had our meeting on Monday, so some of it might be fresh in my mind. Planning was concerned about the high-speed via rail because one route apparently might go through one corner of North Glengarry. And of course, they're concerned that if that happens, that's a lot of farming community up there. And what if the railroad crosses farm property and splits the property? How is the farmer going to get from one side to the other? That's if the rail is on the ground and they're going to go so fast. Of course, they're worried. Tractor equipment doesn't move that fast over the tracks usually. Or they don't even know if the rail system is going to be above ground. And even that creates issues because if it's above ground, you're going to have these big pillars in the way of farmers' fields. So there's these things, and so they were just saying that the counties wants to be involved in any discussion of where this is going to go and how it's going to be implemented. The other main thing was about planting trees along the county roads. We had a committee of council, a whole of council, okay. Yes, I had a hard day yesterday with the power outages and so forth. Anyways.
Batteries are low.
My batteries are low. My cortisol level was very high yesterday. Okay.
Looking at me like I'm going to say something.
Because usually, okay. We had a delegation, a representative, Duncan from Glengarry Federation of Agriculture, present to us, where farmers are objecting to the planting of trees along the roads to prevent drifting. And after that, we as councillors of the upper tier, we got emails from farmers saying, we don't agree with whoever represented us because, no, we think the planting should occur. We had the public. We had many people contact us to say, we want to see the trees planted because there's too much. They're worried about road safety with the drifting in the winter. And so we've agreed to have another committee of the whole on April 7th at 7 p.m. to listen to the other side, and then we'll have to come to some decision of how we're going to deal with the tree planting along the roadsides. Also, winter budget went up. The snow removal went over budget by $1.7 million because it's done from January to December. And we had a lot of snow last spring, and winter came early this year. And of course, they always hope that we go by the 3-year average and maybe we'll have less snow next winter. That was the winter maintenance. And otherwise, the resurfacing and road paving, the tenders have come in lower.
Leave it be.
But now they're worried about the price of oil going up if the AC index is going to be really high when it's time to do the work. And if there's anything else that you can think of, Mr. Mayor?
No, I just wanted to not leave you the only one speaking about the roadside tree planting. There was, the committee of the whole meeting, and it was felt to be fair to everyone involved. There's lots of people that are commuters. There's lots of people that look forward to clear roads. I'm not suggesting Ag doesn't look forward to clear roads, but there's lots of not lots. There's a few opinions that need to be heard, and to be fair, that's the reason why we're doing that, is to make sure that every opportunity is available to those that need to make a comment, yay or nay, pro or con. And so, it'd be another meeting on April 7th, and it'd be similar in fashion to those. I think, I know some people attended the Glengarry Federation of Agriculture's presentation. It'd be similar in concept. There'd be some information provided to counties and councillors about the challenges. So I'm going to move into Parade of Lights. Nothing Garden Party Market. There's nothing that I have. I go to Art in the Waterfront. I look at Councillor Annable.
They're busy booking spots. I think the last count, they had 62 people who wanted space. They're working on their advertising, sponsorships, and they have been meeting once a month. And in another couple of weeks, they're going to start meeting every 2 weeks. But they're progressing well.
It's good to hear. CDHS, there was a meeting recently, the Madam CAO, myself, you were unable to attend. That was held with Sheffield District Historical Society. It was more of just a get-together and information exchange, thoughts exchange. There was really no direction offered. It was just with the recent dissolution of that relationship, physical relationship with Dundas County Archives. They had some questions and concern about the future of the North Dundas Archives, the archival material, the municipal archives, the community archives, archival materials that aren't municipal archival materials. Discussion about that and discussion about possible steps forward. Dairy Fest?
In the package, there's the minutes of the last 2 meetings. This group, the committee this year is a very, very active group, and they're really, really keen. They're working very hard to get things organized. They're going to have, actually, a bike night will be part of the Dairy Fest. There's going to be the classic car show. There's going to be, of course, the antique tractor ride. There's going to be the markets. There's going to be food, music, and so yes, they're really moving right along. So they have a website, and I'll keep you posted with the minutes of every meeting.
And it's gone to a 3-day event.
Yes, 3-day event. Yes.
Downtown Winchester, anything, gentlemen?
Nothing new. No.
Morwood Rec?
April 4th, 1 to 5 p.m. Come down to the Morwood RA Recreation Association's Easter Egg and Touch a Truck event. It is going to be fantastic, fantastic.
What is the timing on that, Councillor?
1 to 5 p.m.
1 to 5 p.m.
Lots of activities for children of all ages. Just a quick question maybe for the clerk, for procedural. For committees of council, do we have to submit our meeting notes? Okay. All right. Thank you.
But I do believe, if I can piggyback to that from, because we've been talking about this a lot, and they have to be approved at your committee before we could include them in the package, so. Okay, if there's nothing else from item boards, committees, council comments, I don't see that there's any. We're going to jump directly into our in-camera session. Moved by Councillor Lennox, seconded by Councillor Urick. Be it resolved that council proceed to closed session at 2:45 p.m. pursuant to section 2392 of the Municipal Act 2001, subsection E, litigation or potential litigation, including matters before administrative tribunals affecting the municipality. All those in favor? Opposed? Seeing none. That's carried. Welcome back, everyone. We're coming back into open session. Moved by Councillor Urick, seconded by Deputy Mayor Bergeron. That be it resolved that council return to open session at, I'm going to say 3:11 p.m. All those in favor? Opposed? Seeing none, that's carried. Our next item is moved by Deputy Mayor Bergeron, seconded by Councillor Annabelle. Be it resolved that staff proceed as directed in closed session. All those in favor? Opposed? Seeing none, that's carried. And if there's nothing else, I will move right into adjournment. Moved by Councillor Annabelle, seconded by Councillor Lennox. Be it resolved that council adjourn at 3:12 to the call of the chair. All those in favor? Opposed? Seeing none. Thank you very much for your attention, and have a good afternoon, and enjoy your March break. And that's carried.